Now, the Medical and Dental Council is worried about the decline in human resource to monitor and track the performance of medical practitioners in the country. According to the regulator, this challenge has become more pervasive as the number of medical practitioners in the country increases. As part of the Medical and Dental Council's strategy to improve the quality and safety of practitioners' care, the Council has produced a policy document on practitioners' stamp, name tags and appropriate apparel. Tasha Michelle was at the launch and files this report read to you.
Following increasing reports that some persons have been passing themselves off as medical or dental practitioners, Chairman of the Council, Paul Kwame Nyame, reiterated the need to identify all practitioners registered with and licensed by the Council.
We cannot talk about the scope of practice for physician assistants without talking about the scope of practice for the other practitioners. So do not be surprised if in the very near future you hear of a beginning in the discussion for the scope of practice for doctors and dentists. You will be surprised if you sit in the council during the disciplinary process to hear what some doctors do beyond their capacity. You'll be surprised to hear of what young practitioners without much experience in their belt, how they rush around to go and do cesarean sections and other surgeries. You'll be surprised to know somebody who has been trained in a certain area. Let me use this just for an example. As an eye surgeon and so on, and decides that for some reason or the other, he will start playing with prostates. So we think it is necessary and important and in the interest of the country and of our constituents that the scope of practice is also constructed for dentists and doctors.
Speaking with JoyNews, Deputy Minister of Health, Alhaji Mahama Asei-Seni, acknowledged the efforts of the Medical and Dental Council to ensure the safety of patients.
If you're not healthy, nothing goes on. And because we have various agencies carrying out health from different angles, it's very good that we have come out with this kind of documentation so that we will guide the practice of every agency. So this is the Medical and Dental Council, and they regulate the practice of all these people, doctors, dentists and physicians. And it is better some of these instruments come out and spell the role of each of these institutions so that there's no conflict.